I would really like to dedicate this award to all the teenagers out there that have really gone through what I'm going through and have suffered from this disease without an end in sight. I know what it feels like to not want to get out of bed from bone pains and exhaustion and days on end and not want to socialize or be around people because the anxiety and brain fog just isn't worth it.
I want to talk to you about a disease that impacted me greatly when I was a teenager, Lyme disease. At the age of 7, my family took a little vacation somewhere on the East Coast. The only souvenir I ended up with on that vacation was a seemingly insignificant tick bite. Unfortunately, due to a failure in the testing protocols at the time, as well as doctors who did not know what to look for, I went undiagnosed and untreated. As I grew up, many unusual things went on. First, it started with severe joint pain. I walked with a cane sometimes. I passed out. I couldn't read. I had migraines. I was hospitalized with anxiety attacks. I thought I was just dumb. I had no memory. It took over a decade, a whole decade, for me to finally figure out what was wrong and get diagnosed. If I had known about the symptoms of Lyme disease, I could have prevented a lot of suffering throughout my teenagehood. Here are some stories of other students with Lyme. I suggest you listen really closely to the variety of symptoms that can be experienced.
When I was first diagnosed with Lyme, it was in 10th grade, but I'd had it since 7th grade, but they had told me I had mono at that point. So then it took 3 years to diagnose, and by that time, the symptoms were worse. My number one main symptom was fatigue. I slept 18 to 20 hours a day. Eventually, I was always confused. I never knew where I was going, what I was doing. And then I slurred my words a lot, and my hands would get really shaky.
I was tired all the time. I used to always play soccer after school. I couldn't even do that. I would just come home and I would sleep. And then I would wake up and I'd have to do my homework, but I would only wake up because I had to do my homework. If it were up to me, I would sleep all day.
It was very slight, but I started noticing that I had a lot more fatigue. I'd come home from school and, basically just go on the couch and sleep for the afternoon.
I used to do triathlons, but I had to stop because I just didn't have the energy to run or go to practice or anything.
When I got Lyme disease and I was diagnosed, my knees hurt all the time, and they would swell up all the time, and I had trouble walking.
Considering, if you look back, a year before that, and I was pretty quick, I was a pretty decent student, and, I was functioning, well in my life. And throughout the season, I just noticed I started having all these injuries, knee injuries, and I didn't know where they came from.
You might get flu-like symptoms, you might get a lot of fatigue, you might find yourself having muscle pains and joint pains. You might feel like your brain is not working quickly enough. You feel a bit foggy. Flu-like illness might last 10 days. It goes away. You don't even know that you've been bitten by a tick or had Lyme disease. And then maybe 4 months later or 5 months later, you may develop a big swollen joint. Typically, it might be the knee. And that lasts maybe, if it's not treated, that lasts maybe 5 or 10 days, that goes away. And then another joint, it could be the elbow, it could be the ankles. So it tends to be what's called a migrating arthritis, where it affects multiple different joints. Then you might find that it's gone up to the tissue surrounding your brain, the meninges, and it can cause what's called meningitis, where all of a sudden you find that you have this rip-roaring, horrible headache. Your neck is extremely stiff, so you can't move your head.
It being misdiagnosed, it ended up developing into a later stage Lyme disease. And I got meningitis. I was in the hospital for several days with my entire jaw paralyzed.
Before I got Lyme disease, I was a really, really good student. I had straight A's, and I would study as much as I could. I would do all my homework on time and everything. And then when I had Lyme disease, all my grades dropped. That whole year they dropped. And I had a very difficult time keeping up with my classes and paying attention. Focusing was also very hard. I couldn't focus a lot. Found myself spending like 2 hours on an assignment that should have only taken me a half hour.
I started noticing that I had a lot of memory issues and cognitive issues. For example, I was at the gym and I was trying to put weights on the barbell, and it took me about over a minute to count how much weight I'd put on the barbell. It was that bad.
It can cause neuropsychiatric problems. So the neuropsychiatric problems occur either because the spirochete, that spiral-shaped organism, has crossed the blood-brain barrier and infected the brain itself, or more likely, it's caused because the inflammation against the spirochete in the rest of the body has caused the production of these things called cytokines, which are the immune modulators that then cross the blood-brain barrier and cause profound fatigue, brain fog, cognitive slowing. All the things that Lyme disease patients talk about can be elicited by these immune modulating agents. So the speed of thinking is slowed in Lyme disease. The attention span is impaired in Lyme disease. The short-term memory is problematic. Because they have a hard time focusing and they have a hard time with their processing speed is slower, they often will need the teacher to provide them with the homework assignments very clearly. They might need reminders about what's needed. So things that wouldn't have been needed before Lyme disease suddenly become very important.
I was pretty much bedbound for a long time, and I was still managing to go to school, but literally my life was get up, go to school, make it through the day, come back home and sleep. That was what it turned into at that point.
No parties, no dates, no hangouts with your guy friends?
I really didn't do anything. Even interacting with people in school was next to impossible for me.
My best friend, everything was fine with her. Like at the beginning when I wasn't going to school, she'd come over like after school. We'd hang out on the weekends, but then I got my PICC line and she's like, we can't hang out anymore. Lyme disease has definitely made it hard to partake in everyday activities. I mean, some days I just can't get out of bed.
And it's hard to explain, not a lot of people could relate to it also, which was very new for me. If you go up to someone and say oh, I'm sick with the flu, everyone's like, oh, I understand. Most people have been through it. The Lyme disease, it's a small handful that have dealt with it, so it's hard.
Oftentimes you have energy. One day you might have energy and feel totally fine. And then the next day you're just in bed,
It's very complicated to the outside world when they see you completely down and out, unable to function, and then the next day or 2 days later you're yourself and you can do things.
It's critical when there's a change in personality, when there's a change in cognitive functioning, when there's a change in energy, when there's a change in the experience of your body with muscle pains, numbness and tingling, joint pains, that you think Lyme disease. Especially think Lyme disease when you have a multi-systemic problem. That is, that affects not just your mood, but also your joints and your muscles.
Lyme disease is a very real thing, and I think that if someone were to tell you that they had a disease like this, it's your job to be there for them and to help them out, and just do whatever you can to be a good friend.
And Lyme disease can cause depression too.
Right, no, absolutely. I mean, it causes, just the fatigue alone can cause, extreme emotional issues. And for me, it was hard to pinpoint, this is Lyme disease. I didn't really know what it was. I just thought it was sort of a transitional period of my life.
And if this goes on undetected for 6 months, a year and a half, you can start to feel incredibly stupid because you're going to be doing poorly all of a sudden, whereas previously you had done well. Now your grades are going to start plummeting, your prospects for the future are going to look less hopeful, and you'll become depressed.
A big aspect of how it affected me emotionally was dealing with the fact that I couldn't do a lot of the things that I used to do.
With Lyme, depression comes with it, but it was more because I had anxiety and stuff. But I mean, since I've gotten better, that's all gone away.
And once the Lyme disease is treated, the irritability goes away, the depression goes away, the memory can return to normal.
Now let's talk a little bit about prevention. I would never want what happened to me and to these students to happen to any other young person, including yourself. Let me explain to you what happens when a tick bites you. And warning, this might be a little bit graphic, but here we go. Most ticks crawl onto you as you brush by them and look for a little place to attach themselves onto you. And you may be thinking, will I feel it? And the answer is absolutely not. The tick secretes a cement-like substance so it won't fall off of you. Then, the tick injects you with an anesthetic. It's like its own form of Novocaine or Advil, so you won't even feel it. Then, the tick spits an anticoagulant into your bloodstream to make sure that you keep bleeding, and an anti-inflammatory so you don't itch or develop a welt. Let me tell you, you will have no idea that you've been bitten. The tick will feed off of your blood for 2 days, and the longer the tick is attached, the greater likelihood of contracting a tick-borne disease. Lyme is in all 50 states and in more than 80 countries around the world. Ticks are all around us. Seriously, they're everywhere. Ticks live in our backyards, on our sports fields, on the beach grass, in the woods, on your lawn, in your garden. Is that frightening or what? And remember, children and teenagers are the ones that are more likely than any other age group to contract Lyme simply because you spend the most time outdoors, which you should. So I'm sure by now, most of you are wondering, how do you prevent this from happening? Fortunately, you're in luck, because preventing Lyme is a lot easier than treating it. Anytime I know I'm going to an area where ticks might live, I remember a few tips. One is to wear light-colored clothing, preferably long pants, long sleeves, and closed shoes, and to tuck your pants into your socks. Not exactly a fashion statement, but I do it. Wear a hat, and you really might want to heavily consider wearing bug spray. When you come inside, make sure to remove your clothes and just throw them in the dryer on high for at least 10 minutes. This will kill the ticks. The next step is to do a very thorough body tick check in a full-length mirror, and you might want to ask somebody to help you check your back and your scalp, because ticks love to hide in warm, damp places. So check every nook and cranny on your body, including the backs of knees, armpits, and anywhere else. Look very carefully, because remember, they're like pinpricks. So if you do happen to find a tick, don't just freak out and yank it off with your fingers. That could actually do a lot more harm than good. You have to remove it with a proper pair of tweezers. Fine tip and as close to the skin as humanly possible where the tick is attached. And you want to pull straight out. Don't use your fingers. If you rupture the tick's stomach, you can actually spill the bacteria that causes Lyme, which is called spirochetes, into your bloodstream. Then you're going to save the tick in a little sealed bag or jar and make sure that you wash your hands and clean the wound with a little antiseptic. Then bring your tick to the local town hall or send it off to a lab to get it tested. As you can tell, tick prevention techniques might not exactly be a fashion statement, but spoken from a fashion designer herself, I really could care less. One of my favorite sayings is, "My health is my wealth." There is nothing in the world that is worth jeopardizing your health or your life.
There is good news about Lyme disease. The good news is that if you catch it early, people tend to do extremely well and have full recovery, the vast majority of people. And even if you're very sick and you get Lyme disease, with proper treatment and intensive treatment if necessary, you also can do very well. Probably the best thing I can say is that I've seen some incredibly sick high school students, younger age kids, recover fully.
I would never want anyone else to go through what I did as a teenager. So please educate yourself and your friends. And visit our website, www.gla.org, for more information.